On the phone, it is Dr. Randy Easterling, family care physician, addiction medicine specialist. Good morning, sir. Can you hear me loud and clear?
Yes. Can you hear me?
I can, if you'll speak up just a little bit closer.
Okay.
I got you. I got one quick shot here. Last year, Notre Dame quarterback Sam Hartman had an unusual surgery. Because of the rare medical condition, Hartman needed doctors to get rid of a blood clot, clean up some tissue in his chest, and remove a rib near his collarbone to prevent future clotting. Never heard of that. Hartman had an unusual request. Before going in for the surgery, he wanted to keep the rib so he could make a necklace out of it like a shark's tooth. Surgeon honored Hartman's request, and the rib is currently in Hartman's refrigerator on its way to becoming a necklace. I've never heard of that.
Only in America.
What's the strangest body part you've heard of somebody requesting as a keepsake?
Well, I don't think we want to go there.
well, that's a lead-in question.
Yeah.
All right, let's get to this thing here because I'm a little concerned. It just seems like this is we have to stay on duty from our convenience stores who are damned and determined to put some harmful stuff out there. Emergency room and doctors, and I've gotten quite a bit of feedback since you and I talked about this. Magic Amanita Mushroom Gummies, but there are a lot of gummies on the market out there. So, First of all, why should we be concerned about this?
Well, first of all, let me say that mushrooms have been used for centuries in spiritual rituals and so forth. You've seen on TV and movies where Native Americans go into kind of a hallucinogenic state to talk to those people in the afterlife and all that. But this is nothing new in terms of mushrooms. Now, having them in convenience stores and having the byproduct of it online, which is mostly bought down online, is a whole different thing, and that's beyond the pale. Amanita mushroom does not contain psilocybin in and of itself. What they do is they extract three acids or three oils from it: the muscimol, the muscarine, and the ibidinic acid. And these three bind to the GABA receptors in the central nervous system. Now, the GABA receptors are the primary receptors in the central nervous system. So what you're doing is you're taking a psilocybin-type product that's extracted from the mushroom, and you're hooking it up with the most sensitive part of the central nervous system. And I can't think of anything more dangerous or just filled with pitfalls and doing something like that, and then put it on the counter for any time Dick and Harry to buy. If you're 5 years old or 50 years old, you go in, put your money on the counter, and you walk away with it. Mushrooms in and of themselves have a very bitter taste, and so they put it in gummies, and they made it a melon taste, a watermelon taste, mango. There's a number of different flavors, and you have to ask yourself, why they put it in a gummy? I mean, gummies are what children eat. I don't think I've ever had a gummy. My granddaughter may have given me one, but that's not something I would typically buy. But you would certainly see children using that. So,
and the package too. When you start looking at the package looks like just a regular gummy bear package. Now you've confused me a little bit, Dr. Easterling. Is the end product that is in the package in the gummies? Does it contain psilocybin, whatever it is, what's called?
Psilocybin. From what I
psilocybin.
read, it did. Now, these may be what we call prodrugs that are converted to a psilocybin-type substance, and they may well be converted to psilocybin. I've not seen that in my reading, and it's very clear that they said this particular type of gummy doesn't have psilocybin.
So what in this package is sending people into paranoia, panic, hallucinations, or psychosis? Is it the three acids that I said were extracted are all hallucinogens. They're psilocybin-type acids.
And so they do the same thing as psilocybin, and they have all kind of warnings on them. They're dangerous. They have sweating, nausea. They take you on a trip. You feel like you could fly. There's a lot of it's a hallucinogenic drug. So it's kind of splitting hairs when you say it doesn't have psilocybin, but it has three acids that are very similar to psilocybin and equally dangerous.
Is there an age restriction that comes with this as far as selling it across the counter?
As far as I know, there isn't. I think this is the same thing we're running into with kratom and what we ran into with teneptine. We finally got the legislature to schedule teneptine, so that's out of the convenience stores. We have not been able to get them to do it with kratom, so we can get that dangerous drug off the shelves. But this is a whole new line, a different approach to get to the public, and it's very, very dangerous. It's very concerning. I used to work in a treatment center years ago before I went to medical school, and the kids would go out and find what they thought was psilocybin mushrooms, and maybe they were, and they would boil them down and make a tea and drink it, and those kids would be sick as a dog. We'd have to take them to the emergency room. They'd be hallucinating, be seeing things, and God knows what could happen in that state.
It is. Mushrooms are quite.
Don't even say anything. Just go on.
Mushrooms can be quite varied. I mean, you've got some that are absolutely delicious and taste like meat. You've got the other ones that are poison, and you don't have mushrooms that you've eaten. I mean, there are mushrooms out there. If you cook them the right way with a little garlic and everything else, I mean, absolutely delicious.
Well, in any good steakhouse you go to, you have an option of having mushrooms put on your steak. I mean, we've eaten mushrooms all our life, but they're mushrooms that were probably commercially grown, and they're safe. Well, they don't have these extracts in them. So it's a whole different animal, you know.
Well, it is. You just have to identify them because they come in a wide variety from poisonous to non-poisonous, and it's one of those things you can't fool around. If you don't know what you're doing, don't reach down and even lick one because it may send you.
But the whole point of these gummies is to be mood altering. People wouldn't buy them if they didn't go from one mood to another mood.
Of
and
course.
They advocate that they treat anxiety, they treat depression, that they accentuate spiritual awareness and so forth. So sure, people are going to try. And they're probably going to get what they think they are looking for, which, again, they'll go back and do it again, which is kind of the pathway to addiction.
Should the concern be elevated to a point where the members of the state legislature listening to this present some type of legislation to take those? And I hate to say this, we keep doing this, but it's necessary. If you've got a 16-year-old who just started driving and they've got a package of these mushrooms gummies in their vehicle, should this be elevated to the point where we have legislation to get this off the shelves?
Yeah, and I think the best thing to do would come up with some sort of generic legislation, and the Medical Association actually came up with a proposal on that. We never could get legs with it, but where all these things would be reviewed by some group and someone would decide whether they could go on the market or not. That might be a difficult thing to do, but I think instead of just putting out fires all day long, because if we stop this, which we should, something else is going to pop up. You made an interesting comment about driving. There's warnings on these drugs when you look them up that says do not operate machinery, do not drive. Talk to your physician before you take these. These are very dangerous mushrooms, and again because of the extracts that bind to the GABA receptors.
And I know we have a history, too, when somebody's doing this, it doesn't preclude them using alcohol with it, and that's just going to up the bad things that could possibly happen. Is there
it's interesting that you bring that up because there are several other drugs that bind to the GABA receptors. Alcohol is one. Benzodiazepines are one. Both of these are central nervous system depressants and some anticonvulsants. And what it does, it blocks your inhibitory receptors. So you lose the capacity to have inhibitions. That's why someone that's had too much to drink might stand on the table and put a lampshade on his head and sing at the Christmas party, or kiss the boss's wife, or stop on the side of the road and urinate. It's not because what the drug is doing; it's inhibiting those parts of the brain that are inhibitory that keep you from doing crazy and stupid stuff, and that's what these mushrooms do.
Is there, can you hang on for a second? I'd love to ask you this question coming back. Is there an alternative or something that would match kratom in a pharmaceutical that the FDA has approved when we return back with Dr. Easterling in just a moment. Bird, Mississippi, Dr. Randy Easterling, family care physician and addiction medicine specialist, been doing this for a long, long time. Kratom, which is still there, and man, every time we talk about Kratom, there is this loyalty base out there says, please don't take my Kratom away. Is there a corresponding FDA-approved, researched pharmaceutical available in drugstores?
Well, yeah, that would be the opioids, all of them, with the exception of heroin. When we first started this discussion over a year ago, I was seeing Kratom, people that have Kratom use disorder occasionally. Now it's an everyday thing in my work. And what they all say is, I was taking fentanyl, I was taking Dilaudid, I was using opioids, whatever. And so I went to Kratom to try to get off the opioids. And guess what? I got addicted to Kratom. And every one of them, without exception, say the addiction to Kratom and the withdrawals are worse than it is from heroin and fentanyl. And that just says an awful lot.
Let's go back to the mushrooms here. Are they also addictive as far as the gummies are concerned?
From a physiological standpoint, I don't think so, but you can certainly get a psychological addiction. I mean, if you want to take a trip, if you want to hallucinate, just such as you did with LSD when we went through that years ago, then mushrooms are what you need. And so if someone enjoys that and gets a high off of it, gets euphoric from it, which you certainly could, then, yeah, you would become addicted to it.
Well, yeah, I mean, there's not much difference in addictions if it's a behavioral thing that you've developed and you can't break, other than a physical thing. So one way or the other, if you continue to go back on it, I guess it still has you one way or the other. Are there
one of the landmarks of addiction is you continue to use the drug or the substance in spite of the negative consequences. Okay, you get a DUI and you continue to drink and drive.
Even if we do this, even if we cut it out as far as the convenience stores, there are so many people who are buying this online, and I guess it's totally legal to do that. Is this coming also from China, or is it made here at home?
I think it's extracted here at home because it's legal in the United States, but also I would assume it's coming from other countries too. I mean, we have such porous borders. I mean, you can walk across the border with anything just about.
Your friend Dr. Edney is coming on with me tomorrow to discuss the Supreme Court's ruling, or the court's ruling on, a federal court's ruling on the vaccine. But since I have you on here, just your overview of this and where will this take us in 5 or 10 years?
Actually, I listened to a segment on NPR this morning driving in, and they pointed out that Mississippi has some of the worst healthcare indices in the United States and in the world with a lot of countries. But one thing that we've always been good at is our vaccination laws, and that's been recognized at the AMA. It's been recognized nationwide, and it's been highly, highly effective. And we're concerned that any loophole in these vaccination laws are going to cause a resurgence of measles, mumps, rubella, whooping cough, most diseases of which, if you're a physician and you're under age 50, you've never seen chicken pox or measles or mumps or whooping cough. I don't think I've ever seen whooping cough. But as a child, I had measles and mumps, as did you, I'm sure. I think I've seen one case of mumps. There was a man that came over from Louisiana, and my partner and I diagnosed it. And he was coming from a region where there was a mumps outbreak because Louisiana had loosened their vaccination laws. So we're going to see a resurgence of some of these childhood illnesses, and that's very, very unfortunate.
How do you, and this is the question that's always posed to me when we have this conversation and debate. Is, okay, if my child, let's take polio, for instance. If my child got the vaccination against polio, and there's a parent that's obstinate, does not want to get the polio vaccine, I'm just using that as an example. My child's in class, he or she is covered, so if you don't want to do it, why should I worry about you?
Well, so if you're vaccinated, then why would you worry about being around someone that's not vaccinated? Is that what you're asking?
Yeah, well, I mean, that is the counter position a lot of people are taking. It's my freedom, et cetera, et cetera.
The answer to that is because the vaccines aren't 100%. So you can have someone that's vaccinated that in fact gets the virus, whatever it is. Now, you don't see it very often, and vaccinations have gone a long way to preventing these things, but they're not 100%. But and another thing too is we have a lot of immunosuppressed children and adults now that we didn't have 40, 50, and 60 years ago because of HIV medication, because of medicines that we take for rheumatoid arthritis. We have some very sophisticated medications now that suppress the immune system. That's the way they work. And so you run into somebody that has measles, and they may not know it. Maybe it's just in the incubation state, but it can be transmitted, and you're immunocompromised. That could be a death sentence for you.
There were some people who are out there saying that the COVID shot, now, as a matter of fact, I think this has been deemed by, I forget what it was a story that I saw earlier this morning, I didn't print it out, calling the COVID shot a bioweapon now. You think the medical situation of the medical industry as a whole are at least holding their thoughts on where we are with this Pfizer and the rest of them, or you would think collectively most doctors are still saying, fine and dandy, get a shot?
Well, to my knowledge, unless something's been developed just recently, most informed physicians recognize that the COVID vaccine was highly effective. It wasn't 100%, and no one ever said that if you got the COVID vaccine that you wouldn't get COVID. What it did is it decreased your chances.
Whoa. I think the President of the United States of America said that.
Well, if he did, it was wrong. What the COVID vaccine did is it decreased your chances of getting COVID, and then if you got COVID, it decreased your chances of going to the hospital, and if you went in the hospital, it decreased your chances of going on the ventilator. I've asked our critical care doctors in the midst of all this, how many COVID patients do you have in the hospital? Our hospital in Vicksburg, they'd say 20. How many of those 20 have been vaccinated? None. They were all unvaccinated people. That's not a happenstance. That didn't just happen. Now, again, the vaccine's not perfect, and there's been some side effects, but I'm of the opinion that it saved hundreds of thousands of lives, and maybe millions of lives worldwide.
Well, when you go back and you start looking at the data now that more people have died from COVID, I hear this, I'm not sure if I haven't substantiated, have died that had the vaccine. The people who are dying are the ones who had the vaccine.
I'm not aware of that. I haven't read anything on that.
All right. So what do we do? What's the in case on this one? Is it something that you think the Medical Association is going to take up as far as the mushroom and the gummies, or is there some lobbying movement to address this in the next legislative session?
Well, I'm sure it'll be discussed. And, again, I'm in favor of more of a generic-type law that would encompass all these what they call food supplements. And that's what they're really listed. By the way, the FDA doesn't regulate these things because they're food supplements. So you don't know what's in them. It may say on the package what is in it, but that's not been verified by some authority. So, hopefully we can get our arms around this thing because it's like ant beds. You just stomp one out and there's another one pops up.
That's a good analogy. And also the only state, believe it or not, the only state that has any regulations on this stuff as far as the mushrooms are concerned, moonshrooms or whatever you call them, is the state of Louisiana, of all people.
Yeah, Louisiana can be very innovative at times. They have some laws that we really ought to look at. But I just don't understand, and maybe it's just because of my generation and my age, the benefit of having a substance that you can buy online or buy in a convenience store that is mood altering, and that takes you from one state to another, and that is hallucinogenic, where you think you can fly, you can climb up on a building or a tree and jump off, and you can fly. You start seeing things, you hallucinate. I just don't understand the social and medical benefit from that.
Well, it's a trip out, baby. It's a trip out.
Yeah, come on. Why can't you understand that? I mean,
well, obviously, obviously you've got the wrong person talking. It should be Perez. He appears to be, at least on the surface, be somewhat.
He's got a degree in this. First of all, it's probably the only medical term that is a psilocybin that he can pronounce.
You got a point there.
Thank you very much.
And he does it with such, I don't know, remarkably polished and rehearsed pronunciation that I worry about him sometimes. So that's it.
It's like Sabalenka, you know.
Yeah, there you go.
Experience behind this.
I think it's this. The answer to that question is people don't want to be where they are in their mind, and they would rather be somewhere else, and that's it.
Well, I don't think that it's an accident that you're seeing a big resurgence of these over-the-counter mood-altering drugs coming after COVID. Because there's so much more depression and isolation and anxiety from COVID that I think, at least subconsciously in a lot of ways, some people are trying to treat that.
Always a pleasure, sir. Thank you for spending the time. Dr. Randy Easterling, family care physician and addiction medicine specialist.